la santé des Canadiens.
Senator Munson?
Thank you, Speaker. I wasn't going to ask a question. This is to Senator Gold. I wasn't going to ask a question today, but I went to bed last night with an image in my head of thousands of group homes for young and older people with intellectual and developmental disabilities. And I do know that in some of these homes that they haven't got the vaccine early because they're in a setting of priority. But Senator Gold, I couldn't help but think of the tens of thousands, for example, Special Olympic athletes who live at home or are independent, who are vulnerable, as statistics have shown, to COVID-19. And I just can't let this issue go. And yesterday you talked about making inquiries. I'm wondering if you or your staff or somebody has made those inquiries to give us some statistical evidence that these people who live at home, young adults who are vulnerable, are getting the vaccine or in the second tranche of getting the vaccine. We're talking about, in the last 3 or 4 weeks, we've heard now that in long-term care homes that the numbers are going down. And that's a good thing. I'm not so sure that those who are living outside of these homes, and even in some of these group homes that people have not been vaccinated, have had the same benefit. So on your inquiries, could you help us out a bit more today?
Senator Gold?
Well, Senator, thank you for your question, and thank you for not giving up on this issue. It's an important issue. I did make inquiries yesterday. I have not got a response back, though I have promised in this chamber, and I'm doing my best to get timely answers. It has not been that, and it won't be quite as quick a turnaround. But as I said yesterday, and I say it with no pleasure, the decision as to how to prioritize what for the moment still remains a limited resource is made by each province. The province of Quebec, where I'm from, has prioritized residents in long-term care homes over others, including my 92-year-old mother, who doesn't yet know when she will get her vaccine. Ontario has made different priorities as other provinces had. I will continue to press for answers to your questions, honourable colleague, and I will report back as soon as I have an answer. Thank you again.
Senator Munson?
Thank you. And Senator Gold, I know you're an empathetic person. I do. I really understand that, and I get that. But just to help you along in terms of people getting you some advice, could I suggest there's the National Advisory Committee on Immunization. It's a scientific body, an external body, and they have made recommendations to the Public Health Agency of Canada. And those recommendations were long before even a vaccine was found. And in their recommendations, I've been going through the whole list here, and I see a lot of words, and I do see care homes and the rest of it, but nowhere do I see, and maybe I'll be corrected if somebody from that organization is listening, the term those with intellectual disabilities, developmentally delayed disabilities, or those with physical disabilities who are vulnerable to this. So in your inquiries, may I humbly suggest that this is a body that would make these recommendations to the federal government. So there's a role with the provinces, and I think the more that we know the numbers, I think the better we'll feel and the safer we'll all be. Thank you.
Senator Gold?
I'll certainly undertake to